Patients do call me with TMJ problems. Sometimes they're having pain, sometimes they're having pain in their forehead. Sometimes it's intense pain. I have a patient recently drive 1 hour and come to me because sometimes I do night guard, sometimes I do Botox, which is a quick fix for the TMJ. Also, I look at the whole picture. If their teeth are not straight and they have very heavy occlusal bite, then I would do Invisalign and straighten their teeth. That addresses some of the issues that the patient is having with the TMJ. There are a couple of options you can do with the TMJ.